welcome back to Metro and Women, where we discuss anything luxury, retail, beauty, cosmetics, as well as home-related. Today we are honoured to have Dr. Renata Roxo, dermatologist on board certified from Brazil. She's going to talk to us about cosmetic dermatology, and she's also a professor in cosmetic dermatology. She works at the General Polo Clinic of Rio de Janeiro and is currently on training in Dubai. Doctor, welcome. So Dr. Roxo has also been in the cosmetic field for the past 22 years, and she's also been part of the American Dermatology Society and Committee in Brazil, and is that correct? Mm-hmm. So Dr. Roxo, we welcome you and thank you so much for joining us. I hope you're enjoying the beautiful weather. It's much better now in Dubai than the past few months. So if you could just explain to us a little bit about your past, your background, and also of course, what have you been doing up until now to reach the potential and where you are today?
Okay, thank you for the invitation. Currently I've been doing a lot of cosmetic procedures, especially Polydioxanone, it's called PDO thread for the rejuvenation. As a PDO specialist, I've been invited to train several doctors through the whole Brazil, and I've been contributed to 2 PDO books, 2 chapters in the PDO books. I also work with a lot of technology devices, such as those for rejuvenation and skin quality, to improve skin quality, filler injection, botulinum toxin, biostimulation, bioremediation injections also. And to be updated, I attend national and international meetings, and that's why I'm here in Dubai.
So you just mentioned that are you here in a meeting capacity or you in a training capacity, which we will talk about a little bit later on?
The training?
Yes.
In Brazil training, I go to all the states to train the Brazilians to be able to doing the patients the PDO treatments. Mm-hmm. It's a trend to improve skin quality too, and gives a little tightness to little light. And all the doctors they bring their own patients, so I help them to do it, the procedure. Okay. And also the devices that I've been using, they're mostly for the rejuvenation and skin quality. Okay. And the fillers, nowadays I use less than I used to use because we need more natural results.
Okay. So the training that you're currently on in the UAE, in Dubai, that is basically you provided training, or did you come for training within the UAE?
I came here to be trained this time, yes, and discuss, because we were here in a group, from Latin America, mostly Brazil, Mexico, Colombia, and Chile. Okay. So we had a big and huge discussion about the fillers and the devices. Okay. So it was very nice, and also we were trained about the fillers that we're going to be in Brazil next year.
Okay, so it's new upcoming trends.
Yes. Okay. And also I've heard about the new devices that's coming too, that we don't have right now.
In Brazil? Yes. Okay. And that is something that you will show us later, the device that you got training on here, correct?
Yes.
Okay. So the other question that I wanted to ask you is, we hear about so many surgery procedures that goes wrong. I mean, the internet is flooded with women that went in for certain procedure and then they come out, and of course just recently one very famous, I won't say her name, but one famous TV personality also went for these procedures and it came out completely different than what she expected. So take myself for instance, if I want to go to do any Botox, fillers, any of these procedures which is not naturally beautiful, what is the signs I need to look out for? How do I know if I'm really going to approach a doctor and I can trust that doctor? What's the red flags we should look out for in terms of these procedures when we actually go and get them done?
Yeah, that's a very, very good question. It's very important to know who you trust and not. When choosing a cosmetic procedure, it's not as simple as buying a product like you go to the store and get the product, where you know what you're looking for. With the growth of popularity of the cosmetic procedures, the patient should know the experience of the practitioner and qualification of the professions involved. It's very important to know among the patients that the person had treated, and I prefer the natural results, so my patients want the same. So it's good to look for a professional that's good, and also to know if the person knows how to manage the complication. Because it's not only to know how to do, it's to know the complication and solve the problem.
Okay.
A lot of how can I say, a lot of professionals don't know how to manage complication, and that's a huge problem.
Okay, understood. So the other question that I also wanted to ask you is, what is the latest trends that are coming up? Because I know beforehand we spoke about natural beauty and the more natural look of things. So it seems like people are lending more to a natural beauty than actually going to get a lot of fillers and Botox done. So what is the upcoming trends that we can look out for, that you see that is evolving and that will happen within the upcoming months or maybe within the next year?
Yeah, I always say less is more. It's the trend now, very good. The trend now is the holistic approach. That's why I'm here too. We discussed a lot about the holistic approach to the science of aging. And the most beautiful for me is the natural result, as I said. I always say the less is more, and it can be these procedures can achieve with the therapy combination and also the daily home care. That's very important too. I like, as I said, the PDO threads, the botulinum toxins, filler, biostimulation, and bioremediation to achieve all these natural results. And also it's very good to associate those treatments to medical devices, that's why I'm here too, and to stimulate collagens and improve the skin quality. It's very important because it's not only one procedure, it's like a mix, a combination that turns better. Also the day life, like what you eat, if you do exercise, if you sleep well, this is important too. But all the treatments, we need to go together to get the more natural results. Not only like a lot of syringes to do one procedure. It's not natural, it's not so good.
So it's basically a combination of good health, good wealth maintenance, and then also these procedures that you do. And one thing that I've also asked you previously is, you hear a lot about the collagen tablets. So I just wanted to confirm, with the collagen tablets, you obviously need extra procedures as well. You cannot just expect the collagen tablets to do wonders to your face. Am I correct, or is there?
No, some people, especially in Brazil, they love the collagen tablets. You can get too, but it's important to use the device to improve the collagen. It's not just take collagen tablets, but a lot of people in Brazil love to take it.
Okay. So doctor, if you can just explain to us a little bit more about the machines, the products, the trainings that you have received in total, and what you look forward to most taking back to Brazil with you, the knowledge.
Yes, this is Zapro. It's a machine to improve skin quality and also stimulates collagen. And it's good because it doesn't pain. Everybody needs no pain. And we start with the water peeling, you see. The water comes with a lot of pressure, and we also put an active ingredient to improve skin quality. So we have the HA ingredient to put in the water peeling. And after the water peeling, we use the light. It's an infrared light that heats the skin. So it improves collagen. So we use a gel with active ingredients too. So it turns better, and immediate, the post-immediate is like a very beautiful skin, and the collagen comes in the time. But we also have another ingredients like for acne, for sensitive skin, and for hair too. And it's good to grow the hair and to clean the scalp. And the good thing is we don't have to time to recover skin. The good thing is we don't need time to recover the skin. So you can do like the machine and go to a party. That's why it's very nice, that's why it's very popular, that's why all the Brazilians want this treatment now.
So you can go to get the treatment in the morning, and in the afternoon you can go to a party without being concerned about any reddish or any things on your skin.
Yes, sure.
Fantastic. Okay.
Yes, also we use there now the Plasma Q2. It's another device for get better the eyelid.
To lift your eyelid.
Yeah, a little lift, but to take care about the skin in the eyelid, and also some wrinkles on the skin. So we use a lot too. That's why I came here to train again. And also the products at home are very important because we need to combine the treatments with the fillers, injections, and also the home device skincare. And it's very important. It's very important to use sunscreen every day, especially here with this sun.
Absolutely.
And in Brazil too. So it's very important because you need to treat, but you need to prevent too.
Okay, so it's a combination of both prevention as well as treatment as well.
Yes.
And Doctor, you mentioned before, how many of these treatments should you say ideally you should take across a period of a year or 6 months?
Oh, this treatment you can do every month, but 1-2 treatments is okay. So you can see the result just after the treatment, but the collagen 1 month, 2 months after. And depends the skin quality too, like if the person's too young, we call the rejuvenation, so you can do once a year, twice a year. But you have an older skin, you need more treatments, like do 3 or 4 a year only. And the good thing is, as I said, there's no pain.
Doctor, thank you so much for joining us today. It was really a pleasure interviewing you, and I'm looking forward to have further discussions with you, whether you're in the UAE or in Brazil. We hope you enjoy the rest of the weather, and thank you so much again for joining us. And for all our viewers out there, please do subscribe. If you have any comments, if you have any questions, you can either comment in the section below, or you can always reach out and send us an email. Thank you so much.